I'd like to thank Dr. Block, who is director of our cytogenetics lab here at Roswell Park, and also Maria Turner, who is the marketing manager for pathology and laboratory medicine, for inviting me to speak with you today about one of my favorite subjects. Before we get to the lab technology aspect of the talk, I'd like to introduce you to some of the things that were going on in the field of medicine in the 19th century that laid the groundwork for what was to come with Roswell Park. It was the right time for this institute to be created, and someone had to see what the potential was, and that was Dr. Park. The first thing that happened was the development of microscopy. We'd had microscopes for hundreds of years. The more modern version came about in the late 1500s. But the lenses in those early microscopes were not perfect, so the image was distorted. And it would have been very difficult to use one of those early microscopes for the kind of research that was required for modern medicine. So in the 19th century, companies in the United States and companies in Germany, you're probably familiar with the name Zeiss, began to produce refined lenses and produce microscopes that really suited themselves to research. The second thing that occurred was the development of anesthesia. Now, we had been doing surgery for thousands of years, literally thousands of years, including brain surgery, without anesthesia. As one example, in 1811, Nabby Smith, the daughter of our second president, John Adams, discovered that she had breast cancer, advanced breast cancer. It had spread to the lymph nodes under her arm. She underwent a radical mastectomy, including excision of those lymph nodes, with no anesthesia whatsoever. And there were many people who went through the same experience. But if you think about that, in that period of time, there's no radiation medicine, there's no chemotherapy. If you have cancer and you need to be treated, your choice is surgery or surgery. Probably not a lot of people were stepping up for that. By the time the Civil War came, morphine was available, but it wasn't always available because supplies were interrupted, and sometimes the demand exceeded the supply. So many men had to have their limbs amputated without benefit of anesthesia. In those circumstances, the speed of the surgeon was key, because you don't want your patient to suffer any more than he has to. But of course, speed is not a virtue when it comes to cancer surgery. The surgeon who's removing cancer has to be very careful, and that would be difficult to do if your patient was in excruciating pain or thrashing about. Even though somebody had to be tied to the table or chair, there was still some movement there. So anesthesia really paved the way for cancer surgery that was more effective. The second thing that happened was an increase in the understanding the link between bacteria and infection. And that began, of course, with the French scientist Louis Pasteur. But even though you have that knowledge that bacteria is causing infection, what do you do about it? Dr. Joseph Lister, in 1876, published a series of articles in the British medical journal The Lancet describing how he sprayed the surgical site and instruments with carbolic acid to reduce the chance of infection, to kill bacteria. Not a lot of physicians accepted this at first, even in the face of scientific proof. And as late as the 1880s, there were physicians who still believed, that infection just spontaneously generated from something called miasma, or bad air. Dr. Roswell Park was one of the first physicians to recognize that this was extremely important. He was a champion of antiseptic surgery. When he was an intern at Cook County Hospital in Illinois in Chicago, he had seen many patients die of blood-borne bacterial infections, and he knew that this was the answer. So when he came to Buffalo as chairman of the medical department of the University of Buffalo Medical School, he taught a whole generation of students, many generations of students, that this was vitally important to the outcomes for patients. And he also took this message into the community to teach other physicians. This is showing an illustration of physicians using carbolic acid to disinfect the instruments and the surgical site. They used a little pump, like the little one that you see on the right-hand side, sort of like what you use in your garden to spray fertilizers in the garden. This is part of a brochure that was produced by Johnson & Johnson and produced free of charge for physicians in 1888, describing how to provide an antiseptic area for surgery and wound treatment. And of course, we have another lasting reminder of the work of Dr. Lister on your bathroom shelf. Dr. Park had said in one of his books, "The medical student of the present generation has no conception of the contrast between the results of today and those of a generation ago. The two great 19th century achievements in surgery were anesthesia and antisepsis." So not only did we have safer surgery as a result, but we began to eradicate some of the dread diseases of that time. Cholera, malaria, typhoid, through better sanitation, for example, sewage treatment and cleaner water, through public education, teaching children to wash their hands, to cover their mouths when they sneezed or coughed, not to spit. And we also had the development of vaccines. And all of these factors played a role in changing the face of death in the United States. Let's look at the leading causes of death in 1850. Dr. Park is not quite born yet. So we have, up at the top, we have three: cholera, malaria, and typhoid, that are going to be eradicated because of the measures I just described. So let's take a look at how things have changed by 1900, which is 2 years after the establishment of Roswell Park. Now some of those diseases have fallen off the list. Others have moved to different parts of the list, and new diseases have risen to take their place. Take a look at number 8. Cancer was not on that list in 1850. Dr. Park saw this happening before the Institute was founded, and he realized what was going to happen. He predicted, rightly so, that cancer would become a leading cause of death in the United States and in other countries around the world. And he believed that well-organized research, which had eradicated those other diseases, could be brought to bear on the problem of cancer. This was his goal. Here's Dr. Roswell Park, quite a mustache. Another thing that happened around this time was that government began to take an interest in public health. Maybe they did it for the better good, for humanitarian reasons, maybe they did it for economic reasons, or a combination. But by 1900, we had 45 states in this country, and of those, 40 out of the 45 had developed state health departments. Unfortunately, New York was not among those. We didn't found our state health department until 1901, but Dr. Park saw which way the wind was blowing. Government was beginning to get involved and to take a concern for the health of its citizens. And so he came up with an idea. In 1897, with Mr. Edward Butler, who was editor of the Buffalo Evening News, he traveled to Albany and met with members of the legislature and with New York State Governor Frank Black, and proposed the creation of a laboratory at the University of Buffalo, which was then over on High Street. The medical school was on High Street across from Buffalo General Hospital, and I think it's really neat that they're coming back home after all these years. He proposed a laboratory that would focus exclusively on finding the causes and possible cures for cancer. They wanted $10,000. Both houses of the legislature thought this was a great idea. They passed the bill. Governor Black was not so certain that that was a good idea. He didn't think it was the business of government to get involved in public health or to look for causes of disease. So he vetoed the bill. But Dr. Park and Mr. Butler were not dissuaded. They came back to Buffalo and they waited until the next year because they knew it was an election year. So they went back, and this time, persuaded by various newspaper editors who were friends of Mr. Butler, they passed the bill in both houses of the legislature and the governor approved it. Unfortunately, this didn't really help the governor very much because there was a scandal in his administration, and before the election, his party chose another candidate, and that's how Teddy Roosevelt became governor of New York State. But anyway, now Dr. Park had his $10,000, and so the lab opened in 3 rooms of the medical school, and the work got started. Over the years, Roswell Park has gone by several different names. In 1898, we were the University of Buffalo Pathological Laboratory. In 1900, in recognition of the Gratwick family, who had been generous benefactors supporting our work, it was the Gratwick Research Library, or Laboratory. In 1912, the New York State Institute for the Study of Malignant Disease. In 1946, Roswell Park Memorial Institute. And in 1992, to better reflect for the public the work that we were doing here, Roswell Park Cancer Institute. This is Dr. Park operating at Buffalo General Hospital. In the beginning, we did not have a hospital here. We were just a laboratory. And he did his surgery over at Buff General. This photo shows the surgical amphitheater that was created for him there. In fact, when he first came and began practicing surgery at Buffalo General, they did not have their own surgical instruments. He had to bring his own surgical instruments to work and carry them from place to place wherever he was doing surgery that day. This is the Institute's first hospital, the Kerry Pavilion, which opened in 1913 with 30 beds. It was at the corner of Oak and Carlton. And for the first time, we're uniting patient care with laboratory research. Unfortunately, we were behind the 8 ball on this. After Dr. Park opened the laboratory in 1898, some places in Europe had looked at our model and said, we want to do that too. We think that's a great idea. So they opened their own cancer institutes, but they went a step further and opened hospitals as well to take the knowledge from the laboratory into the clinic and vice versa. I'm not sure why. I found out that very early, I believe it was 1901, plans were laid and submitted to the building department for the city of Buffalo to create an annex on Buffalo General Hospital that would be a cancer hospital. Those plans never came to fruition. It wasn't until 1913 that we opened our first hospital. And I want to pause just a minute and give you a little bit of an idea about how much time we're talking about. We like to think of time in terms of numbers of years. So that seems like a long time. In fact, this Friday, April 29, marks the day that Governor Black signed that bill into law. So it will be our 118th anniversary. 118 years, that seems like a really long time. Except if you look at it a different way. My husband and I both have grandfathers who were born in 1879. By the time Roswell Park opened in 1898, they were already 19 years old. So I'm only 2 generations removed from a time when there was not a cancer-specific research institute in the world. This was the first one. When this hospital opened in 1913, that's the year before my father was born. Not very long at all. Dr. Park felt from the beginning that the relationship of laboratory work, clinical study, and education must be closely associated. Think about what we do today. It's exactly the same. We do research, we do patient care, and we have the Division of Educational Affairs. It's exactly the same. Those 3 things remain united after all these years. He also placed great importance on pathology, and in the early years of the Institute, we provided free pathology services to any physician in New York State. Think about that. If you're a patient out in East Podunk, nowhere, New York, your physician could send your biopsies here to Roswell Park and benefit from the greatest pathologists available in the United States. And as a result, we also got a lot of referrals from those free pathology reports. Number 1 on our list of laboratory technology, the Pku test for newborns. I've talked to a lot of people here at Roswell Park about the history of the Institute, and many of them have no idea that this test began at Roswell Park. It began with a man by the name of Robert Guthrie. He was an MD and PhD. He had earned his medical degree, but wasn't really interested in practicing medicine. And so he came here and focused on trying to find cures for leukemia. Dr. Guthrie had a woman in his lab by the name of Ada Susi. She had come here from her native Estonia with her husband. She had been a nurse in Estonia. And she went to Iowa when they first came to the States to practice as a nurse. When she and her husband moved to New York State, for some reason her paperwork did not allow her to practice nursing here. So she and Dr. Guthrie got together and she became his principal laboratory technician. Dr. Guthrie and his wife had a child who was developmentally disabled. So because of this, they became very active in a local chapter of the organization that was then called the Association for Retarded Children. Through that organization, he met a man who told him about something called phenylketonuria, which involves a protein called phenylalanine that builds up in the blood of babies who are born with this. It's a genetic disease. It's a rare disease. And if they eat a high-protein diet, over time, they become developmentally disabled. They needed to find out which babies were at risk for this so that they could be put on a diet that would, for the rest of their lives, keep these very serious health effects under control. So Dr. Robert Warner, who was head of this organization, spoke with Dr. Guthrie and asked him if he could come up with a simpler test for determining phenylalanine levels in these children, because he said when we're monitoring them as things go along, it's very difficult because we have to take out all these tubes of blood and send them to a lab in California. It takes time, and we really need to be able to do this faster and more efficiently. So Dr. Guthrie went back to the lab, and 3 days later, he and Ada Susi had come up with a method of using a small amount of blood on a card. You might have heard of the Guthrie card. That's Dr. Robert Guthrie, which allowed them to do this very rapidly and very efficiently. The PKU test for newborns was introduced in Massachusetts in 1963 and was made mandatory testing for all newborns. If you go online, you'll see a number of sites will say that the PKU test was developed by Dr. Guthrie in 1963, at which point he was no longer at Roswell Park. But in fact, the book that I've listed on your suggested reading list says that he was here at Roswell Park and that he and his lab technician came up with this test. Ed Naylor, a gentleman who was a postdoc in Dr. Guthrie's lab, said the ideas were Bob's and the work in the lab was Ada's. By the way, the PKU test is a good example of how something that grew out of research at Roswell Park became a business. They set up something called the PKU Cottage next to Children's Hospital, where these tests were created and sent out across the United States, and lab technicians from all over the place, hundreds and hundreds of lab technicians, came to Buffalo for testing. In 1958, Dr. Guthrie and Ada Susi left Roswell Park and went to Children's Hospital. And there's Dr. Guthrie. I wish I had a photo of Ada Susi, but unfortunately I've looked everywhere and I don't have one. Number 2, the PSA test for prostate cancer. This guy in the middle is Dr. Ming, one of my favorite people. On the left, of course, is Dr. Candace Johnson, our president and CEO, and on the right, Dr. Moeller, who is head of our urology department. In the 1960s and 1970s, researchers were looking for tumor-specific antigens that would help them detect different kinds of cancers earlier. The prostate contains hundreds of proteins, so it was very difficult to sort through these. But Dr. Chu and his team compared human prostate tissue from cancerous areas and benign prostate enlargement tissue to identify the specific antigen that was at work in prostate cancer. They were able to do that. They identified prostate-specific antigen, and it was first used as a test in 1990 to monitor treatment response of men who were being treated for prostate cancer. It was a few years later, in 1994, that the FDA first approved the PSA test for screening for prostate cancer. And I remember that date very well because 1994 is also the year my dad died of prostate cancer. So this test is very important to me. If you're fortunate enough to see Dr. Chu on campus, he's a professor emeritus here now, you might want to stop and say hello. I thanked him for helping protect the lives of my 2 sons with this test. Since this discovery, 1 billion PSA tests have been administered around the world. William Catalona, professor of urology at Northwestern University, wrote in 2014 PSA is the best test currently available for early prostate cancer detection. Dr. Muller recalled that when he was practicing in 1990, only 4% of prostate cancers we diagnosed were curable. Now with PSA, the cure rate is between 80 and 90%. In 2014, the American Association for Cancer Research named PSA a landmark scientific discovery of the 20th century. Number 3, RPMI 1640. A few years ago, I went to a conference out in San Francisco staffing the Roswell Park booth where we were trying to recruit some new faculty members. And time after time, people would stop by and pick up our literature and they'd say, "Hey, you're the people who invented RPMI 1640. We use that every day." RPMI 1640 is very famous. It's a medium for growing cells. And this is the person, Dr. George Moore, who was director of Roswell Park from 1952 to 1967, who helped create this medium. He constructed a plant, sort of like a mad scientist looking plant, for growing human lymphoblastoid cells in massive culture tanks, the largest scale that had been used for mammalian cells. Here's a picture of the plant that I put in there specifically because of the beehive hairdo. The culture medium was used for growing tumor and other cells in the laboratory, and it enabled researchers to develop cultures without using proteins that might harbor viruses or impurities. Here's RPMI 1640. Today it is still manufactured on Grand Island. Another example of research at Roswell Park contributing to our economy. If you go on the company's website, they will tell you that if you are in the United States and you order RPMI 1640, it was manufactured in Grand Island. In a 1988 article, the Rochester Democrat and Chronicle talked about a different use of RPMI 1640. They were doing an article on the burn and reconstructive surgery research that was being conducted at the University of Iowa. Since 1970s, the department had been using cadaver skin for burn victims, but they had no way to stock the skin, so it might not always be available when you needed it. And then the article says, after failed attempts at freezing skin and one-day preservation, they discovered RPMI 1640 solution, which mimics the physiological components of plasma. It preserves skin for 3 weeks or more with an 85% survival rate. Number 4 and number 5, I see we need to wind up here quickly. Our voluntary donor center and number 5, these are combined, we were among the first cancer centers equipped with an automated blood cell separator. Now I'm going to take you away from Roswell Park for just a minute to introduce you to this remarkable man, Dr. Emil Freireich of the National Cancer Institute. If you saw Emperor of All Maladies or read the book, he figures prominently into research related to leukemia. He was a hematologist, and he was in the wards one day, in the pediatric wards, with Dr. Gordy Zubrod, who was then director of the NCI. And they were looking at the children in the wards, and many of these children hemorrhaged to death, many of them, because as a result of their disease or the treatment for their disease, they did not have enough platelets in their blood. Only at the time, nobody knew what was causing this hemorrhaging. They went through the wards and they saw blood everywhere. It's a very touching story, and I encourage you to read it. It's on the suggested reading list. This is available online. There's an NCI Cancer History Project in which they interviewed Dr. Freireich, and the transcript of that interview is on that reading list. Dr. Freireich said they stopped at the bed of a little boy named Scotty Dinsmore. He was 4 years old. They had grown to know the family. Dr. Freireich said, "We loved him," and they also knew what was going to happen to him. Dr. Zubrod turned to Dr. Freireich and he said, "You're a hematologist. Figure out what's going on." So Dr. Freireich went back to the lab, and eventually, by comparing the blood of the children who were hemorrhaging with those who were not, he realized there was only one difference, and that's there wasn't enough platelets in the blood of those children who were bleeding. And that led to the development of plasmapheresis, taking blood components from a donor, taking whole blood from the donor, spinning out the components that were needed, that would be platelets to prevent bleeding, and taking out white cells to help control infection. And so the remarkable part of this, where Roswell Park is concerned, is that Dr. Elias Cohen, at that time, was Associate Chief of the Department of Laboratory Medicine here at Roswell Park and Director of our blood bank, which opened in 1962, I believe, 62? Maybe 64. Anyway, we were one of the first 8 medical facilities in the nation authorized by the National Cancer Institute to test the effects of plasmapheresis. And here's Dr. Elias Cohen on the right with one of our donors on the left. However, this was not the most efficient process. And so later on, in 1962, I'm going back a little bit, this gentleman, an IBM engineer named George Judson, went to the NCI and met with Dr. Freireich. Dr. Judson had a son who had leukemia, and he said, I want to do anything I can to help you come up with better treatments or to help these patients in some way. So together, they actually took throwaway parts from IBM, and they cobbled together the automated blood cell separator, which greatly increased the efficiency so that today it's a simple process. I have to tell you, I'm a platelets donor, and if you have not done it here at Roswell Park, I encourage you to do it. It takes 2 hours. You can get time off from work, up to a certain number of hours per year, and they have cookies and other kinds of good things to eat. So this really dramatically influenced the death rates of leukemia patients because they were no longer bleeding to death as a result. I want to tell you a story about this too. This gentleman on the left is named Robert Mort. He was a railroad worker in his 40s, 49 years old, and he lived in Huntington, West Virginia. In 1970, he began to feel very unwell and extremely fatigued. So he went to his next door neighbor, who also happened to be his doctor, and he learned that he had acute myeloid leukemia. In those days, if you had AML, your doctor would probably tell you to get your affairs in order. Things were very, very grim for those patients. But his doctor was a very smart man. He sent him for chemotherapy. However, as a result of the chemotherapy, he developed leukopenia. Didn't have enough white cells to fight infection. So his doctor said, I know that at Roswell Park Cancer Institute, or it would have been Memorial Institute in those days, they're one of 30 hospitals that have this automated blood cell separator machine. You can go there and they might be able to treat your leukopenia. So he did come here, and we did manage to control his leukopenia. As a result, he was able to enroll on a clinical trial that at that time was being conducted by Dr. Jim Holland, another famous person from Emperor of All Maladies, still practicing at Mount Sinai in New York City. And Dr. Holland and Dr. Jerome Yates were at that time conducting a clinical trial that later became known as 7 and 3. It was a combination of chemotherapies. Those numbers refer to the number of doses of each drug. So because we were able to control his leukopenia, Mr. Mort was able to enroll on that clinical trial. And as a result, 7 and 3 worked so well that it became standard of care for AML and remained standard of care for the next 40 years. So what happened to Robert Mort? He's 95 years old today, and he lives in Baltimore, Maryland, with his daughter Heidi, who's the little girl in this picture. I asked Heidi what it meant to her that her father was able to come here when we had the expertise and the technology to treat his leukopenia. And she said, I got to have a dad. Every day, the work that you do in laboratory technology means that somebody else gets to have a dad, or be a dad, or mom, or child. And there's nothing more important than that. Thank you for the work you do, and happy Lab Week.